The Cook cervical ripening balloon is intended for the mechanical dilation of the cervical canal prior to labor induction at term, when the cervix is unfavorable for induction. Before you begin, perform an abdominal ultrasound to confirm singleton, vertex presentation, and to rule out partial or complete placenta previa and/or placenta percreta. Place the patient in the lithotomy position and insert a large vaginal speculum to gain cervical access. Before you insert the device, prepare the cervix by cleaning it with an appropriate cleaning solution. Loosen the fitting on the proximal hub of the stylet and adjust the wire so that the distal tip of the stylet is even with the distal tip of the cervical ripening balloon. Tighten the fitting so that the wire does not move during manipulation, and seat the adjustable handle firmly into the blue port labeled S. If necessary, use the cervical ripening balloon with stylet to traverse the cervix. When you have traversed the cervix and the uterine balloon is above the level of the internal os, remove the stylet before you advance the catheter any further. Advance the cervical ripening balloon until both balloons have entered the cervical canal. Inflate the uterine balloon with 40 milliliters of sterile saline by using a standard 20 milliliter Luer lock syringe through the red check flow valve marked U. Once the uterine balloon is inflated, pull the device back until the uterine balloon is against the internal cervical os. The vaginal balloon should now be visible outside the external cervical os. Inflate the vaginal balloon with 20 milliliters of sterile saline by using a standard 20 milliliter Luer lock syringe through the green check flow valve marked V. Once the balloons are situated on each side of the cervix and the device has been fixed in place, you may remove the speculum. Add more fluid to each balloon in turn in 20 milliliter increments until each balloon contains a maximum of 80 milliliters of sterile saline. Take care not to overinflate the balloons. If necessary, the proximal end of the catheter can be taped to the patient's thigh. Please note that the device is not intended to be in place for longer than 12 hours prior to the planned induction. To remove the device, deflate both balloons through the corresponding valves marked U and V and remove vaginally. Please see the cervical ripening balloon instructions for use for complete instructions and warnings.